Hey everyone, Dr. Raphi Wald here. Just wanted to talk to you a little bit about autism today. These days we call it autism spectrum disorder. There have been some changes in the ways that we diagnose autism. Approximately 10 years ago, we came out with a new DSM, Diagnostic and Statistical Manual, which is essentially a big book which identifies all the different psychiatric diagnoses that can be diagnosed. So when that came out, there was a change to the way that we used to diagnose autism. In the past, there were different types of autistic disorders. One that's very commonly heard of is Asperger's, which is essentially a person who has a lot of difficulty socially but can function well in a lot of other areas. Autism was considered a more serious diagnosis relative to Asperger's in most circumstances. But these days it is done slightly differently. These days, there only is one diagnosis really called autism spectrum disorder, and the way it's differentiated is by levels of impairment that it creates, levels 1, 2, and 3. So with level 1, a person has a slightly lower level of disability and generally can function fairly well. With level 2, a person needs a little bit more help and assistance as they go along, and level 3 represents a much higher level of disability. I hope this education helps. Thanks so much for listening. I will talk to you all soon. Bye-bye.